today is Dr. Manjula. He's a medical doctor with a master's degree in biomedical informatics at University of Colombo, Sri Lanka. He currently works as a medical officer for health informatics under Deputy Director General of Public Health Services. And he is also primarily involved in developing the Sri Lanka Health Informatics Roadmap in public health. Please welcome our moderator for this afternoon, Dr. Manjula Dharmadarwana. Good afternoon, Dr. Manjula.
Thank you for the introduction. Good afternoon, and nice to see all the participants from Bangladesh, Cambodia, Indonesia, Pakistan, Philippines, Sri Lanka, and Vietnam. Maybe others will be joining soon. Okay, let me introduce to you our team of speakers today for our topic: health informatics training in Indonesia. They are health informatics educators from Dian Nuswantoro and Gadja Madah University, Indonesia, Dr. Lutfan Lazuardi, Enny Rachamani, and Dr. Gadja Madah. Main speaker, Dr. Lutfan Lazuardi, is a medical doctor with postgraduate degrees in health service management at Gadja Madah University, Indonesia, and Instruct Medical University, Australia. Since 2007, he is the director of the Master Program of Health Management Information Systems under the Public Health Department, Gadja Madah University. He did in the afternoon presentation. With Lutfan's team are Dr. Gadja and Enny Rachamani. Dr. Gadja is working with Dr. Lutfan at Gadja Madah University, while Enny Rachamani is a professor at Dian Nuswantoro University. Take questions on the second half of our session. For participants, you are free to interrupt Dr. Lutfan to ask questions during his presentation. However, we would appreciate best if you can reserve your questions for our discussion after the presentation. You can use the chat box or raise your hand button on this. Let me now welcome Dr. Lutfan and his team to continue the presentation.
Dr. Manjula. Yeah, Dr. Manjula. Yeah, maybe I just open it can for Well, Dr. Guardian is not yet here right now, but he will join the session afterward later on. And yeah, it is glad to me to meet with all of you, and we would like to share our actions within the health information training program in Indonesia. And okay, first of all, I would like to give you some information about the situation in Indonesia, about the demand of the health informaticians, which is actually very high, as you may see on the slide that we have 33 provinces. We have about more than 500 district health office, as more than 1,000 hospital, and also about 9,000 primary health centers. And all of these organizations actually also deal with the health informatics activities. It is why the demand is very high. And based on several surveys that have been trained about the health informatics is not more than 30%. So it's less than 30%. And it is why now the government, the Ministry of Health, is also um, university to provide training activities as well as the graduate program about the health information system. And yeah, and in our program, we did set the core competencies, which is actually a result of many workshops and meetings with various stakeholders, like the Ministry of Health, or the district health office, the hospital, primary health center, and other various stakeholders, which is maybe will use from training services. And the activities we have conducted, then we to set the core competencies. There are three main competencies. One, management of health data and information. Using information technologies to manage data and information. And the third one is about the project management. See that the district health office and also some health organization will also responsible for the IT project management, especially in the health sectors. And on these core competencies, we also develop some training materials, training modules, which is you can see on the slide. Okay, the students, the target students in our program is actually also very. It's from many healthcare organizations and also the organizations like the Ministry of Health, provincial and district office, health centers, as well as the public health workers, which is maybe working in the non-governmental organizations, and also fresh graduate students. Actually, since 5 years ago, we already have a master program in the health management information system, which is actually to program with the curriculum as see on the slide, several modules which is related to the public health, since that our master program is under the public health institute. The 6% of the curriculum is about public health, and the 40 is about health information systems. Degree of this master program in health management information system is also the master of public health. Clear enough my voice, or hello? To make you can see my voice clear. Okay, then I can continue the presentation. And based also the curriculum of our master program, then we design also the 3-month training program. And the target of the student of this training program is also the same like the master program that we have. So we already conducted this training program for 2 times. This is 3 months, and the goal actually is quite the same. We made some modifications that we put some practical works also here, and also some technical things which is not included in the master program, such troubleshooting and also the little bit programming in this training program. And actually, the module is delivered in the first 2 months, and in the third month, they sit in the health organization. Yeah, and also like other program and also the graduate program, we also have evaluations. And actually, from this activities, we also then will evaluate. I are already in their working. It seems that we would like also to know whether the result of their this training program is relevant to their work or not. I'll show you the result about the evaluation later on. And actually, just to show you that we define the core competencies and the training modules, also try to include activities which is usually they did in healthcare organizations, like they should also do the training activities, the development, implementation, and evaluation. And the red one, IT project management, IT and management of health data and information, is actually about the core competencies. And we develop tools which is related to the each competencies. And as you see, there are 10 modules about IT project management. There are 3 modules related to the SIS, strategic planning, project management, and also evaluations. Then we also have the modules about the ICT infrastructure, basic programming, and also data and data warehouse. It is maybe more technical aspect, and also troubleshooting. And then for competent management of health data and information, we have module data analysis and presentation, health GIS, and also the medical record and clinical information system. These all modules are delivered in 2 months, and then in the third month, they have to conduct the internship in various health organizations, like the primary health centers, the hospital, and also the district health office. Okay, and this is the result of the evaluation from the participants. For things that are the contents of the module relevant to their needs, then actually quite surprising, so that some modules may not, or at least less relevant, like the database and data warehouse. It's somehow maybe for teaching answer that the module is less relevant. But this is actually also maybe due to the fact that the background of our student is usually public health practitioners and also the health professionals, and they don't have the knowledge before about the test programming and also maybe some technical things. Then we'll feel this training modules maybe will somehow too advanced for them that have the background in the health fields. Okay, and yeah, this is the last slide. That actually, when we did this training we included many stakeholders from the Ministry of Health, and also other healthcare organizations, as well as the university. and it has been tested in University of Gadja Madah. But then now, together with the Ministry of Health and also other universities, we would like also to scale up and also enlarge the implementation of this module to other universities. And this year, we plan to also adopt the module and introduce to other university, like in Kalimantan Island, Sulawesi, and also the Papua Island, which is mostly in the east part of Indonesia. And in the next year, we plan also to adopt in other university in the uh, north and also in the west part of Indonesia. So, well, yeah, also to show you some activities that actually it was the activities from the last training programs, and also visit some healthcare organizations and also do some entertaining activities. Seems that actually they also feel based on the evaluations that 3 months training program is very expensive, and they may also feel um, they that they need also some entrance activities. It is why then maybe you can see also that they also have some have activities, outbound activities and also outside activities, and then they can refresh again to back to the campus. Yeah, that's all the information about our training activities, and so, yeah, sorry. Okay, that's I think, and I'll be happy also to join with the discussion. Thank you, Dr. Manjula. I give to you the forum.
Well, thank you so much, Dr. Lutfan. That was very fantastic what you have done. Not only like starting at the end of your tutorial, getting connected, and taking it to other universities. That was fantastic. Good job. But to start with questioning, I think you must be having a question in your mind. So I'll just start by asking my question. There are students from the field and non-medical fields. What are your thoughts on the thoughts on the enthusiasm, the interest, and the outcome of these two categories?
Well, actually, of the in our training program is come from healthcare organizations, and healthcare organizations. All are actually from the health organization, because this is actually the requirement of the entrance. They already work on the health field. And so maybe the fact in Indonesia that mostly people that already working in the sector and also have responsibility to deal with the data and information actually has not been trained about the health management information system, or health informatics, let's say. Is it answering your...
Yeah.
Yeah.
Thank you. Well, to continue that, what are your thoughts on incorporating health information management into undergraduate course curriculum during, like before starting out as a medical doctor? What are your thoughts? Is it necessary? Do you think, or is it better to keep it as postgraduate?
Yeah, it's actually very good question, since that our institution under the Faculty of Medicine, and now we only have the master program in health management information, but not undergraduate program. And this is also actually the now we are discussing that maybe to some extent we also will maybe think about the possibility to undergraduate program, undergraduate program, but I think it will take time. Since that since quite long, our master program is related to the health, public health. Yeah, it takes time to open the new programs, which is maybe different level.
Well, there's another question from Istan. I think you have seen the question. No? How big are the classes for the 3-month course?
Yeah, for this training programs, it into shift, and well, actually we already conducted 2 times, and in each time we have about 15 students. Yeah, about 15 students. Actually, I have also need to mention here that this training activities that we have conducted in collaboration with Ministry of Health, and also funding from GIZ. And at that time, the GIZ gave support also for the scholarship for the students. And actually, the people would like to participate on this training session is quite high. There are about more than 100 of people apply to the program, but because of the limited seats, we only accept seats 15 per term.
How many week do you meet the students for the 3-month course? How many faculty are needed? That's why I received, I think, the question I received.
Yes. Yeah. Maybe we can share you also the schedule. But just for the short information that actual instructions, this 5 days activities to Friday. They have the full course from about 8 to about 2 or 3 p.m. And yeah, but the activities is not only on the class. We also have the site visit, and also have some technical practices, and also discussion. So it's not only about lectures, but various methods we use to deliver the contents of the training material to the students. And about maybe more than 30 members that involved in this activity. And actually, we also include some trainers from outside university, like from the district office, from primary health center, as well as from the hospital. So, yeah, maybe in total about more than 40 trainers in this activity.
Is this a residential program, and what are the methods for this time. Two questions, one from Naveen Agarwal and from Dr. Sambat. I can see Dr. Sambat's question. What are the methods used for this program? And is it a residential program?
This question, could you please repeat? Sorry.
Sorry,
I have a question, Sambat. But could you please specify what you mean with the method here? Well, in terms of delivering the training modules, actually we have the like we have the discussions, we have the practical as well as the site visit.
I think we can see the question. Can you hear me? You mentioned that third month is an internship. How are you set up the internship activity? Yeah.
Yes, this is actually the individual activity. So it's students in the third month then will have to do the internship in one of the health organizations, and we then that they should we decided already to organization that they have to do the internship. Because in this case, most of the students come from outside Jakarta, which is actually quite far from other island also. It is why then we decided that they should do internship in Jakarta, which is close there, close, and with the place also, and they the internship in the hospital, in the primary health center, as well as in the district health office. And actually, this is the individual activity. Only the some of the participants are in the same institute, but actually they are doing the same, the different activity. And an issue also, they have to deal with some issue that interested in. So it's also related to the small research at the end of the internship then.
Another question to Rachamani. It's from Eunice. How often do you revise the curriculum in Dian Nuswantoro?
Hear me?
Yes.
Yeah.
In Dian Nuswantoro University, we are in undergraduate in medical academy and public health, but concentration on health information management. And we usually revise curriculum every 3 years. So we get we share questionnaire to stakeholders. After that, we have some meeting to make a request to our curriculum. That's all.
Thank you, Dan. Question. After the 3-month training, do you set up employment for the graduates?
Well, this is interesting question. Actually, they all are already work in the health organizations like health centers, district health office, provincial health office, as well as in the hospital. So this is actually the things that we are now also interesting in, because as see on my first that the demand of the health informatics space is very high, because actually, as you see that we have a lot of healthcare organizations which is now also have responsibility related to the management of the data and information. And this several survey, it is interesting that all of the and most of the health organizations only have a limited number of people that has been trained about the health informatics. And yeah, this I think was should consider that we should also now train the people that already employ and also responsible for the data and information, but not have been trained yet. But yeah, in the next future, now we also think about the future career, and also maybe related to the working environment that fits to the graduates. Since that now actually there is still no and also maybe structural positions that actually specialize for the health informatics in Indonesia. Now the Ministry of Health still in discussions to the positions for the health informatics and the health organizations. So it's not in a formal like example, medical practitioner or maybe epidemiologist or biostatistician that is already reached as the professional.
Another question to Enny. Can you share the difference of health information management in Dian Nuswantoro?
Because we are in undergraduate, there is quite different with Dr. Lutfan. Because undergraduate we have medical record academy. It's in field competency. In the bachelor degree we have with concentration in health information management. We usually in public health we concentrate in best information system in primary health care. That's a difference.
Yeah. There's another question for the 2-year master program. Where did it start and how many graduates so far?
Yes, started in our university. It was started in 2005, and now already about 130 graduates, and all already work in the health organization, in the provincial and district health office, or work in the Ministry of Health, and also some others work in hospitals. We have about 20 students, 20 to 30 students each year.
That's good. That's good. I saw bioinformatics on the semester 2 curriculum in your presentation. How much bioinformatics do you teach? Is it just an introduction, or up to have what kind of knowledge that you give to your students in regard to bioinformatics?
Actually, it is introduction course about the bioinformatics, and we introduce theoretical and concepts about the bioinformatics, and also do some practical work which is maybe possible to be done in the organizations, mostly in the health offices, like the sequence analysis and maybe some other which is they usually have the data, but actually it is not yet in the field that all the health institutions have the bioinformatics field. I mean, it's a production course to introduce bioinformatics concept that maybe health organization in Indonesia have the activities related to the bioinformatics field.
Nice to hear. That the participants have in mind. Type it in the chat box if just type it and then we'll try to answer.
Thank you very much, Dr. Manjula and Dr. Lazuardi, as well as to Enny Rachamani. It's a very fruitful session for every one of us here at Sekra. Thank you very much for attending. I would like to have to say my thank yous for the countries who attended our AeHIN Hour this afternoon, to our colleagues and friends in Bangladesh, and to Cambodia with our participant, Dr. Sam, and from our participants in China. Ms. Sophie, nice to have you back after last AeHIN, after your last in our attendance last year. This was last year. To Dr. Patrick Silin, who's here also in the Philippines. So, Dr. Manjula, any message to our participants? Other things to say, or a short summary of our discussion?
Thank you so much, everybody, for attending this AeHIN Hour today. I think everybody must have got a lot of insight into how to set up and how to conduct and how to improve health informatics, health information management education within your country, and to contribute to the region. Thank you so much.
Thank you very much for your kind words, Dr. Manjula. Now, I would like to invite everyone to please open your web cameras or your video so I can capture your virtual presence in this AeHIN Hour. For those who have their webcams, you can opt to turn it on. So there's a screenshot of everyone in the other side. Thank you very much, Dr. I saw also the video of Dr. Manjula. We are still waiting for the other webcam to load. Ms. Tongshin is from the Ministry of Health of China. She is also part of the Scientific Committee of China Health Information Network. Silin, So, 1, 2, 3. Smile. Able to get that? Clear. Green. We're